Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Lansoprazole tablets, exploring the various aspects of lansoprazole, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Starting with use of lansoprazole tablets. Lansoprazole is a medication classified as a proton pump inhibitor and is commonly used to treat conditions related to excessive stomach acid production. Here are some common uses. Lansoprazole is often prescribed to heal and prevent the recurrence of gastric ulcers, which are open sores that develop on the lining of the stomach. It is also effective in treating duodenal ulcers, which are ulcers that form in the first part of the small intestine. Lansoprazole is used to manage symptoms of gastroesophageal reflux disease, a condition where stomach acid frequently flows back into the esophagus, causing irritation and discomfort. In cases of Zollinger-Ellison Syndrome, a rare condition characterized by tumors in the pancreas or duodenum, lansoprazole helps control excessive stomach acid production. Lansoprazole can be prescribed for the treatment of erosive esophagitis, a condition where the lining of the esophagus becomes inflamed due to stomach acid. Next, dosage of lansoprazole tablets. The dosage of lansoprazole tablets varies depending on the specific condition being treated. It is crucial to follow the healthcare provider's prescription and instructions. For gastric ulcers and GERD, the usual adult dose is 15 mg or 30 mg once daily, depending on the severity of the condition. It may be taken with or without food. For duodenal ulcers, the typical adult dose is 30 mg once daily, usually taken before a meal. For Zollinger-Ellison Syndrome, the initial doses may be higher and are adjusted based on individual response. It is usually taken in divided doses. It is essential to take the medication consistently and for the entire prescribed duration, even if symptoms improve before completion. Next, discuss mechanism of action of lansoprazole tablets. Lansoprazole works by inhibiting the proton pump in the stomach lining. This pump is responsible for producing stomach acid. By blocking this pump, lansoprazole reduces the production of acid, helping to alleviate symptoms and promote the healing of ulcers and esophagitis. It is a delayed-release medication, meaning it is designed to release the active ingredient slowly to provide long-lasting effects. Next, side effects of lansoprazole tablets. While lansoprazole is generally well tolerated, some individuals may experience side effects. Some common side effects are headache, nausea, diarrhea, constipation, abdominal pain, and dizziness. Serious side effects are rare but may include severe allergic reactions, kidney problems, and bone fractures. It is important to seek medical attention if any unusual or severe symptoms occur. Lastly, discuss important advice for taking lansoprazole. Take lansoprazole at the same time each day to maintain a consistent level in your bloodstream. Do not exceed or skip doses without consulting your healthcare provider. Prolonged use of lansoprazole may increase the risk of certain side effects. Regular follow-ups with your healthcare provider are essential. Inform your healthcare provider about all medications, including over-the-counter and herbal supplements you are taking to prevent potential drug interactions. Consult your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding, as the safety of lansoprazole in these situations should be evaluated. In addition to medication, lifestyle changes such as dietary adjustments and weight management may be recommended for optimal results. Always consult your healthcare provider for personalized advice based on your medical history and specific health needs. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking lansoprazole tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.